Next, we have to discuss about the topic handling or processing of prescription. It is nothing but it is the various activities which a pharmacist have to be carried out after receiving the prescription. It should be received and handled by a registered pharmacist. These are the various steps which are included in handling of prescription. First of all, pharmacists have to receive the prescription from a patient and read and check it carefully for whether there is any mistake in the dose or dosage form or whether there is any incompatibility. Then after checking, pharmacists have to compound, package and label the product. Then dispensing, recording and refilling. We have to discuss all these various steps in detail. So, first step is receiving the prescription. We already told that prescription should be received by a registered pharmacist. After receiving the prescription, pharmacist should read it carefully, and if there is any doubt or mistake in the prescription, he should not express on his face, because if he express any doubt on his face, patient get difficulty to follow the medication or follow the medicine which are dispensed by the pharmacist. Okay, so should not express any doubt. Then if the drugs which are prescribed in the prescription is not in stock in the pharmacy, just return the prescription and guide him to get the medicine from any other pharmacy. Then next step is reading and checking the prescription. After receiving the prescription, pharmacist should read and check it thoroughly and make sure it is legally correct. Legally correct means check whether all the legal requirements of the prescription is followed. For example, all parts of the prescription such as date, prescribers, register number and address, all that parts of the prescriptions should be checked. And if there is any doubt or there is any mistake in prescription, consult senior pharmacist or prescriber, but patient should not know about this. Then pharmacist should check all the ingredients with the quantity, dose and whether there is any interaction or incompatibility between the drugs. Then if there is any mistake in the dose, pharmacist immediately consult the prescriber. If pharmacist cannot consult the prescriber, dispense according to dose specified in the pharmacopoeia. Pharmacopoeia means it is an official publication which contains all the monographs of all drugs. So, dispense according to pharmacopoeia. Then, next step is compounding, packaging and labeling the product. The compounding include two various steps, that is first one is weighing and second one is preparation. During weighing we have to avoid reweighing, so all the ingredients which have to be weighed are kept on the left side of the balance and all the ingredients which are weighed are kept on the right side of the balance. By keeping like this, we can avoid the reweighing. Then next one is the preparation. For the preparation of all dosage forms and all the products, there is a standard procedure. So follow that standard procedure for the preparation of all products. Then equipments which are used for the preparation should be clean and dry, and the preparation process should be carried out in a clean and neat place. Then next, packaging. All the products should be packed in a suitable container of appropriate size. That is, the package or container should not be much higher or much smaller the size. It should be appropriate. Container should be appropriate for the contents of the drug. Then the packing container should be clean and made up of good quality material. Then labeling. Label should be neat and legible, and size of the label should be proportional to container. That is, size of label should not be much higher or much smaller than the container. It should be proportional to container, and label should be fixed properly to the container. It contains all the details of the pharmacy, medicine and patient. Then label should be rechecked thoroughly before it is dispensed. Then next one, dispensing. Preparation should be checked thoroughly before it is dispensed to a patient. Medicines should be dispensed to the patient in a polite manner, and pharmacist should explain or should provide all the information about the medication. For example, dose, dosage and route of administration, time of administration and storage condition, and if there is any special instruction should be provided. Then next one, recording. Pharmacist should keep a register in the pharmacy, and all the preparations compounded by the pharmacist should be recorded in that register. This record contains date of dispensing, name and address of prescriber, name of the patient, name of drugs with their quantities, then pharmacist's signature. Then if the drugs which are supplied in their original containers, all the details should be entered in the cash or credit memo book. Okay. Then in case of Schedule C and H drugs, do you know what is Schedule C and H drugs? There is a rule, there is an act, Drug and Cosmetic Act, D&C Act, which is related to our pharmacy drugs. According to this act, D&C Act, all the drugs are classified into different schedules, Schedule A, Schedule B, Schedule C and so on. So, Schedule C drugs are the biological products. For example, vitamins, adrenaline, serum, etc. And Schedule H drugs are the drugs which can be sold only by prescription of a registered medical practitioner. That is, these drugs cannot be sold without a prescription. In this case, in case of Schedule C and H drugs, name of manufacturer, batch number and date of expiry should be noted. Okay. Then last one is refilling. If practitioner prescribes the same medicine again and again, then pharmacist should refill or should dispense it again. Then in case of refilling, pharmacist should note down the quantity dispensed and date of refilling. If the period or if the time for refilling is over, pharmacist should not refill the prescription. Pharmacist should ask the patient to consult the prescriber or doctor for further refilling. Okay. Then next one is refilling of narcotic prescription. Do you know what is narcotic drugs? Narcotic drugs are the addictive drugs which are used for getting relief from severe pain and which give a unrealistic well-being from the pain. So it is addictive and habit forming drugs. For example, morphine, heroin, opioids, etc. So it is addictive and habit forming drugs. There are many rules and regulations for dispensing and refilling of such drugs. Refilling of narcotic drugs can be done only after checking the physician's signature and register number. It can be done only within the period which is specified by the prescriber in the prescription. Then pharmacists should follow the directions which are provided by the prescriber, and exact quantities which is prescribed by the prescriber should be dispensed. Should not dispense more quantities. Okay. Then at the back of prescription, date and quantities of refilling should be noted along with the signature of the pharmacist. In United States, refilling of narcotic prescription is prohibited because there is misuse or abuse of narcotic and habit forming drugs. To prevent the misuse or abuse of narcotic and habit forming drugs in US, refilling of narcotic drug is prohibited. That's all. Thank you.